my session, I like to thank organizing committee, especially the organizing secretary, Mrs. Shaila ma'am, for calling me and inviting me for the conference, and as well as I like to thank Karthik Shivan and my mentor, Pranisulam sir, and my good friend Tulsi, and Sugandhi also. So today I'm going to talk about contrast administration techniques in CT. As I mentioned, this is purely research oriented, especially for the interns, PG students. You must listen this talk. The reason is, definitely you are going to get some good topic because you are PG, you must have dissertation or thesis work during your study. So there are a lot of, I can give you 10 topics, 10 titles on this topic to do the research work. So all of you are very well aware of that contrast when we administrate. The most of the places do a hand injection, but nowadays, as per my knowledge, every center has at least a single syringe or dual syringe. So, but most of the places are having a dual syringe injector. So, if it is single syringe injector is there, means what supposed to do? If it is a dual syringe injector is there, what supposed to do? And whenever you are injecting the contrast, what are the different factors? Because I am very confident that whenever you are in posting, you are not going to listen much about the technical part. You just see that the senior most technologist will be there, and he or she will say that you have to give 8 ml contrast to this patient, and then the person will say this patient is weighing 80 kilo, so 80 ml is enough. Give 3.5 ml per second, enough. So you just listen, but you don't understand what's the reason behind it. So whenever we are injecting the contrast, there are two types of contrast, where we do contrast scan and non-contrast scan. So whenever we are injecting the contrast scan, all of you know non-iodinated contrast we inject. See, how many of you seen the graph here? Can you make out the graph here? Yeah. And you can see the cross-sectional image of chest, and there is a placement of ROI here. How many of you see? Can you lift your hand? I'm not going to ask question, don't worry. Very few. It means you are not seeing, you have not got a posting in CT? No? You might have got a postings in CT, maybe you are not observed. Okay. See, before I start my session, I'll give you one example. See now, see here, patient is lying down. Patient is lying down here. So we have placed the cannula. Okay, we have placed the cannula here, and we also placed the tracker. Okay, or initially we place it a localizer or locator, and we do a tracking. So you might have heard about bolus tracking, right? In the G it is called as a smart prep. In other modalities and all is called as a bolus tracking. So now we place the cannula here, right? Now we inject the contrast. So contrast are flowing. So in this place, simultaneously the scans are going on in a single image. Simultaneously when the contrast started injecting, so you can see the other side of the monitor here. Continuously the image will appear, and we have placed the ROI in this place. Okay, pulmonary artery, where we place the ROI, where we get the Hounsfield unit. You can see here the Hounsfield units are coming. See now, this is the example single one image. The second image, the third one, and the fourth one, and the fifth one. When it goes to fifth one, the ROI crossed the threshold 50. once the threshold is crossed, you can see here the 64 is the final last image, Hounsfield unit, right? So automatically will scan takes the place. So we no need to press it in a manually. So that is the facility usually in, it's there in the every modality. Can be a 16 slice, can be 8 slice, or it can be in 128 or more than that. So this facilities will be there. So we do a continuous tracking in this place, and we, in case the cannula is placed somewhere in case the cannula is placed somewhere in the antecubital vein at the elbow level, for the same patient, the reaching contrast from this area to the tracker, and if the cannula placed at the level of wrist, reaching contrast to the tracker will vary. So we have to keep it in mind. In case sometime, I seen recently when I was in the console, the technologist, inexperienced technologist was doing a scan, and where the bolus tracking or tracker was not able to properly follow. Then in such cases, if the person having a knowledge about bolus tracking, he can do the scan without the bolus tracking. That's the facility. So when you are injecting the contrast, there are 3 different factors are affecting. One is patient factors, the second one is contrast media factors, and the scanning factors. So especially when it comes to a patient factors, definitely the person to person it will vary, and wherein the contrast media factors and the scanning factors usually stands constant for most of the scanning centers. When it comes to a patient factors, target area will vary, sometimes chest, sometimes abdomen, sometimes lower limb angio or cerebral angio. So what are the different factors? Weight of the patient, height, and cardiac output, age and gender will vary patient to patient. It definitely is not the same for all the patients. So when it comes to a scanning factors, scan duration and scan delay will vary. Usually scan duration will vary, but scan delay usually constant for all the patients. And other parameters like kV, MA or whatever, slice thickness and all the patient is constant. When it comes to a contrast media, again, what type of concentration we are using, and what is the rate, and what is the saline flush are used. I think this is also some of the time. The total volume will vary according to the patient height and weight. But when it comes to the flow and as well as saline flush, all will be constant for most of the patient. So we'll just discuss about it. As I mentioned, a little bit complicated to understand. I'll try to explain it in a very simpler way. See, now example I written here, the contrast enhancement versus weight, means the factors affects whatever I mentioned. Now we are comparing with the contrast enhancement and the weight of the patient. See, now whatever example I am going to do in further slides, all the patients are 30 years old and 170 centimeter height, and here whichever the contrast enhancement is you see in the graph are one patient with the 50 kilo weight, you can see the black, and the red one 75 kilo, and the green one 100, and the lowest one which you see that the graph is 125 kg. So now for all the 4 patients we are given 125 ml contrast with a 350 mg iodine concentration and 4 ml per second for all the patients. Am I right? Here what is the constant? The constant, the contrast amount or saline, the ml flow rate, everything constant for all the 4 patients. But you see the graph, it means the enhancement. See this, the 125 kilo weighted patient, the maximum HU you found around 200 to 250 between, where you see the red graph, it is nearly 300 HU, it means highest P, and the black one you can see the 50 kilo weighted patient, the highest enhancement was between the 350 and 400 Hounsfield unit. It means, I think whenever you are doing the any angio or any procedure, is it required 300 to 400 Hounsfield unit to get the angiogram to do? Not required. You can have it between 250, 300 if it is there, more than enough. So what is the what is the reason, or what is the behind this result? You unnecessarily injected 125 ml of contrast to the 50 kilo weighted patient. That's one reason. The second reason, see, now you wanted to get the enhancement of between 250 to 300 Hounsfield unit. For the 125 weighted patient, you injected 125 ml, which is not sufficient. You may need to inject additional. So it means, according to the weight of the patient, you have to give the contrast to the patient, right? So that is what is given here, you can see. So difference between 50 kilo weighted patient and the 125 kilo weighted patient. So next, the contrast enhancement versus injection rate, right? Now here, the total amount, see here example again, the amount of contrast is given, the patient weight, 30 years old aged patient, and the patient, the other parameter will stay constant, okay? So if you are injecting the contrast 1 ml, you see the graph, and if you are injecting the contrast 60 seconds continuously, you see that. It means, what is the benefit of this? The scan duration, in case is a longer scan durations are there. It means you should have the longer the amount of flow or amount of contrast injection supposed to be there. We call it as a window period. You can see the green line, what I is showing here. You have enough window to complete the scan with the good enhancement of the contrast. Okay. And one more, the factors affecting the gender variations. As always, when you are doing the scan, you please remember the male and the female, the contrast enhancement, even though if you have a constant of contrast as well as scan, flow rate, everything, it is not equal. You can see here, there is a study where the mean time for the female to reach the particular area, it is taken 11.64 seconds, and where for the male, it is 13.55 seconds. It means, usually, the contrast reaching to the particular area, compared to the female, male patient will take a longer time. So, whenever you are starting the scan, you should see that the contrast reaching to the particular, example, now you are doing an abdomen scan, where you will place the locator at the level of D12 L1, or some places D11 and D12 in between that, right? So, for the female and the male, the contrast reaching that particular area will vary, especially for the male, it will take a longer time. So next one, regarding cardiac output, but as of I seen, even I had a study in this, there are 3 studies published in this article related to cardiac output, where whichever patients are coming to our department, as I see, most of the patients are having a normal cardiac output, so we didn't find much variations. But this one I adapted from one of the published article in the journal. We can see, in case the baseline cardiac output, the contrast enhancement, if it is in a 300, right? If the cardiac output reduction of 60%, you can see the topmost here, the curve, and it was between the 400 and 450. It means, so whenever you the file comes to your department, you must open the file and you should see the ejection fraction report. the area in the echocardiography, you should see ejection fraction. That's very important. So based on that, you should plan flow rate, not amount of contrast, not a concentration. The flow rate you have to adjust according to that. Okay. So that is what I give an example here. The difference between 20% reduction, if it is there, what is the contrast enhancement? If it is 60% reduction is there in the cardiac outputs, what is the enhancement are given here. So next, one more, total volume. See, in case, again here, the patient, for all three patient, all the three graph, what you see here is a constant height, weight, age of the patient. If you are injecting 75 ml contrast to that patient, you can see the total volume. I'm talking about here, 75 ml total volume you are injected to the patient. You can see the enhancement, and if you are injecting 175 ml to that same patient, you see the enhancement. If you are injecting 75 ml, it may be a reduced, it may be a lesser amount of the contrast you are injected to the patient. If you are injected 175 ml, it is not necessary to inject, because by 125 ml, you are able to get a good window period here to complete the scan. You can see between this red graph, between the window period is enough to conduct the scans, any scans. Means it will have enough, around 60 seconds. You can see from it is starting the highest peak from 20 seconds, and the lowest peak is around 105. It means 80 seconds gap you got to complete the arterial phase of the scan. It means 125 ml is enough to get the good scan. The similarly flow rate, you can see the flow rate now. Example, 125 ml is given to all the three patients, and for one patient, for the same patient, we are given 1 ml per second, 3 ml per second, and 5 ml per second in a three different scenario. Okay, when it is injected 1 ml per second, you can see the graph, green color graph, what you see here, had a longer enhancement curve, but the peak is maximum 150, which is not enough to get a good MIP image or angiographic image. For that, if you are injected 3 ml per second, you would have got a good peak, enhancement of the Hounsfield unit, and enough window period to complete the scan. Okay, so in case if you are giving 5 ml per second, usually for angiography sometimes they give, but for routine scan, other reason and all, see the window period is hardly less than 20 seconds. Means within 20 seconds you are not able to complete the scan. It means you are not able to get the good or early or proper arterial phase, because at the scan it just goes on, the half of the scan once it is complete, then you will try to, you will able to see the venous phase. So that's the reason injecting flow rate also is very important. So saline chaser, it is very important. Whenever I go to the most of the examination session, I'll ask what is the reason of using saline chaser. Most of them are not able to answer. The first reason, you are able to reduce the total amount of contrast reduced to the patient. The second one, you will have the flow rate constant at the end of the, at the complete of the contrast injected to the patient, or complete of the scan, you are able to get the flow rate constant. That is the benefit when you are using saline chaser. So this is the concentration in case if you are using a different concentration of the contrast. See example, 300 mg iodinated per ml, or 350 or 400. There are three different iodine concentration contrast is used for a same patient. If you are injecting 300 ml, you can see the Hounsfield unit peak around between 250 to 300, and you can see if it is 350 means nearly between the 300 and 350, and if it is 400 mg means the between 350 to 400. But most of the places, as of I seen, 350 or 370 concentrated iodine contrast medias are used most of the place to get a good image. So whenever you are conducting a scan duration is very important. If you're having a longer scan duration, you should have even the constant flow rate of the contrast plus the saline chaser is very important. And sometime machine delay, that's you cannot avoid, because there are, as of I seen, even though the locator and the scan starting area, even though if you kept very closer or overlapping, still you will find 1.5 to 2 second delay scan when it is taking arterial phase after the peak time. So scan, and another one is scan direction. So that is also very important whenever you are taking scan. So tube voltage also will one of the important factors affecting in Hounsfield unit, enhancing of the Hounsfield unit. See, I'll give you one example here. The same patient factors as I mentioned earlier, 30 years old patient, 70 kilo weighted patient, then the height is 170. Okay, constant height of the patient. If we are conducting 3 scans for the same patient, you see the kept 80 kVp for the scan, first scan. You can see the Hounsfield unit you are able to, at the same location, you are finding 41, and the same patient, if you kept 100 kVp, you see the same location at the area 31 Hounsfield unit, and if you keep 80 kVp, the Hounsfield unit is 26. It means whenever you are conducting a scan, kVp also one of the important factors. Most of the time, even earlier my study days during my BSc, I was thinking about, due to contrast, I was thinking that if I inject more contrast, more the enhancement. Right? No. Later I realized, because I had done a thesis, my thesis during my PG in this topic, due to variations of the kVp also, Hounsfield unit will vary. So whenever we are keeping kVp, we have to be kept in mind. The Hounsfield unit also will vary according to the kVp. Okay. So these are the take-home points. So patient-centered or individual or personalized are highlighted in the Patient Protection and Affordable Care Act in most of the countries. A patient-centric approach to CT balances contrast doses with the radiation dose. That's a very important thing, because as the concentration and as well as the amount of contrast you inject more, the more the radiation to the patient. Okay, so whenever you are injecting the contrast, you should keep it in mind the adequate, or you can say it as a required amount only to be injected to the patient. And the tailoring scanning technique like protocols and the radiation doses according to the clinical indications, the body region and the patient size must be kept in mind. And optimize the patient quality and safety as well as efficacy and efficiency is possible when you know there are 3 different patient factors or contrast factors or scanning factors are is to be considered whenever you are doing the CT scan. So these are the references. You can see there are very good journal, articles, research articles available related to this study. So with this note, once again, I thank the organizing committee for giving the opportunity. Thank you each one.